Good morning to one and all. Today we are here before you to present on the topic robotic telepathology. Robotic telepathology is a practice of medical diagnosis facilitated by digital transmission of pathological data. Images can be transmitted via ordinary telephone lines, satellites, and internet. It enables a pathologist at a distance to use a personal computer to simultaneously control a robotic microscope and to view the data on a monitor screen. It helps for the employment of a pathologist not readily available at the site of site. The technique of using robotic microscope at the transmitting site by the concept of virtual microscopy has gained a considerable progress for research and education. This technology utilizes digitalization of whole microscopic glass slides via computer-aided systems to produce virtual microscopic slides. Studies related to telepathology are limited to the field of neuropathology and cytology preparations. Telepathology can be classified into three types: store and forward telepathology, dynamic telepathology, and hybrid telepathology. Store and forward telepathology. It involves capturing of still images and transmitting them in an asynchronous mode. Dynamic telepathology. It is a real-time method which transfers video stream from a remote site to the telepathology service with the digital or video camera. Hybrid telepathology. It's a method which combines both static and dynamic telepathology methods. It was Ronald S. Weinstein who coined the term telepathology in the year 1986. In India, the first exposure was provided at a symposium organized in 50th Annual Conference of the Indian Association of Pathologists and Microbiologists in Mumbai in 2001, and it was named as Telepathology Today and Tomorrow. Compared to the traditional method, it is a faster and easier mode to share images. In case of traditional pathology workflow, after the preparation of tissues, it is couriered, analyzed in lab, and the patient gets diagnosed. But in the digital pathology workflow, after preparation of tissue slides are being created and analyzed digitally and get diagnosed at a faster rate. This technology has a greater significance in the provision of an urgent diagnostic service in the absence of a local pathologist. The distant pathologists have a remote control over the local microscope, and the pathologist having the slide in person is instructed by the distant pathologist at the receiving site.
Robotic telepathology can be used for remotely rendering primary diagnosis, second opinion consultation, quality assurance, education and research purpose. Medical professionals in different locations can view images simultaneously and discuss diagnosis through teleconferencing. Patients' data can be synchronized across various electronic health information systems. Robotic telepathology has not achieved widespread adaptation due to need for someone trained to operate at the remote site. It is expensive due to skilled labor cost. It is expensive to operate than the traditional system. Pathologists have limited control over the slides and images. There is a chance for the pathologist to incorrectly get diagnosed without recognizing the errors. This technique faces a great challenges like quality issues, legal issues, patient's confidentiality, de-skilling, and backup plans. Quality issues include standards like image resolution, color depth that should be captured, speed with which image should be transferred, necessary qualities of any viewing station to ensure that the captured is not degraded. Legal issues. It arises when telepathology service is used from outside national boundaries. For example, in European Union, the registration of reporting pathologists must be recognized by the regulatory body of the European Union member state. An essential requirement in order to maintain proper standards of reporting. In case of patient's confidentiality, expert advice on data protection is needed. If patient's identifiable or potentially identifiable information is being transmitted. De-skilling or loss of relevant local expertise can occur if particular category of specimens are routinely allocated to report over a long-term period. Backup plan. Laboratories must have procedures to maintain activities in the events of equipment failure. There must be procedures in place to ensure sufficiently rapid repair or replacement of sophisticated equipments. Although at present, the system is not capable of replacing an on-site pathologist, the results were encouraging and suggest that the remote control, remote diagnosis has the potential to increase the efficiency of pathologists. This method has potential to improve several aspects of pathological practice for the better benefit of patients' care, hoping a better future in the technique of robotic telepathology. Thank you.
Thank you.